Hi, I'm Melissa Bantug here at the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined with Dr. Linda Lee. She's a gastroenterologist and she's also the director of our Integrative Medicine Center here. Hi Dr. Lee, it's great to have you here.
Well, thank you so much for having me.
Will you tell me the difference between integrative medicine, alternative medicine, and complementary medicine? I feel like we throw those terms around quite frequently without really understanding the difference.
Absolutely, and a lot of people get confused. They are really not the same thing. So alternative medicine are those practices that people seek out to do that are separate from conventional medicine. And complementary medicine are those practices that they wish to use in conjunction with conventional medicine, but they may not be concerned about whether or not there's evidence to really support their use. So they might start using these therapies just based on what their friends say or what they've read. Integrative medicine, however, tries to tie the best of conventional medicine and other therapies, other healing modalities that are evidence-based and put them together. And it's a very highly individualized approach because it depends on one's own values and cultural beliefs.
Wow, that made it so clear. Thank you very much. Can you tell me some examples of what integrative medicine might be?
Well, integrative medicine it can be viewed in different ways. So integrative medicine is providing, as I said, the best of different healing modalities. So for example, at our center, we offer conventional medical therapy in addition to acupuncture, massage therapy, behavioral medicine, and nutrition consultation. If you go to different integrative medicine centers, they may offer other modalities. But again, what integrative medicine centers tend to have in common are evidence-based therapies. Integrative medicine is more than just simply the therapies that are being offered, however. It is bringing that highly individualized approach. The idea is to empower an individual so that they can be an active member in their own health care.
After a patient finishes treatment for cancer, what are some of the things that integrative medicine can help with?
Oh, there are so many different things. I'm so glad that you asked that. We know that going through cancer therapy can wreak havoc on a person, not just physically, but emotionally and spiritually. So this is where integrative medicine can be extremely useful. So unfortunately, many people have side effects as a consequence of their chemotherapy or surgical therapy or radiation. And there are many aspects of integrative medicine that could be very helpful. So for example, we see people who have neuropathy as a result of chemotherapy, and there has been some evidence to suggest that maybe acupuncture can be helpful in those situations. We know that there are individuals who have a lot of digestive disorders, and being a gastroenterologist, I'm particularly sensitive to those things. We know that a lot of people have alterations in their taste buds so that their nutrition is not what they necessarily need so that they can recover and be healthy once again. So this is where we can really help. Oh, and I should mention that we have the behavioral medicine aspect because again, we have to recognize that going through an illness and sometimes, you know, cancer is a chronic illness. It becomes a chronic illness. People are living a very long time with cancer. It's no longer considered just an automatically fatal disease. But dealing with the aspects, the emotional aspects of having a chronic illness is really important. Because many people do suffer, for example, from what they call brain fog or from insomnia or anxiety or depression. That part has to heal as well.
And so if a patient was interested in coming to see you or somebody else at an integrative medicine center, how would you recommend that they talk to their oncology team about what they were interested in doing?
I think it's important to ask their oncologist whether or not they know practitioners that might be helpful in their cancer care and to make sure that they express what their concerns are. I think what we get into trouble with as conventional practitioners is that sometimes patients get the idea that we don't want to really know what else they're doing, but we really do want to know, so that if they're interested in supplements or doing what we call alternative therapies, I want to know. I may not endorse them, but I want to help educate them and direct them to the right educational resources so that you can get accurate information.
As a gastroenterologist, can you tell me how important it is for a patient to practice things like a healthy diet after cancer treatment?
Oh, diet is always important. Diet is important at any time, before, during, and after. It is true that what you eat can affect the way you feel. Now, what is not true is necessarily that eating a particular diet or eating a particular food is going to cure you of cancer or prevent you from getting cancer. We know your risks of getting cancer are lower if you eat a healthful diet, which includes fresh fruits, fresh vegetables, whole grains, and not too much red meat, right? So that is helpful, but we don't have any evidence that even taking a multivitamin every day or taking a particular supplement is going to prolong your life or necessarily prevent you from getting cancer. So diet is important though because our gastrointestinal tract really does respond to the kinds of foods that we present it with. And if you consider that 70% of your immune cells are in the wall of your gut, you know, you might really pay attention to what you're putting into your system.
It sounds like integrative medicine can be really helpful in treating the whole patient. Can you tell me a little bit about some of the potential barriers to receiving integrative medicine?
There are actually a lot of barriers. To start with, many of the therapies that we offer may not be covered by all insurance companies. So unfortunately, some people have to pay out of pocket and the cost can be prohibitive. But there are some programs that we have to try to alleviate that. And we have some right here at Johns Hopkins. Another barrier is that many healthcare providers, even here at Johns Hopkins, are not familiar with many of the therapies that are available in an integrative medicine center. You have to remember that a lot of our conventional medical school training did not include getting exposure to people who practice in other ways. And so it really is up to us as healthcare providers that if we want to be the most helpful to our patients, even if we don't wish to do acupuncture ourselves, for example, that we begin to learn about it and to understand who are these people who can do it, how have they been trained, what is their education, you know, what is their certification, and are they interested in practicing in an integrative way? So unfortunately for many of us as conventional practitioners, you know, because we don't know about these things, we sometimes say, oh, it's just so much easier not to learn about them. And the problem too is that we don't often read about them in our own journals, because when there are studies that are out there to show that there's some evidence to support them, they get published in journals that we don't come across too often. So as a healthcare provider, it's important that we make an extra effort to read about these things so that we can be knowledgeable for our patients.
And finally, if we hear from a patient that is interested in receiving integrative medicine or learning more, what would be a good resource, or do you have tips on finding somebody who would work with their oncology providers?
Well, first of all, I would say please check out our website, hopkinsintegrative.org, and where we have a list of all our services and practitioners. I think it's important that people read about the benefits of therapy, and again, it's hard to find reliable sources, but I do recommend the NIH website. That's definitely a good place to start. And I also recommend, as I said, having a conversation with your oncologist. I know our practitioners will not recommend any specific therapies without the approval of their oncologist. Because sometimes there's not a good time to initiate a therapy. But that doesn't mean you can never have it, but it means that maybe it would be safer for you to wait until after you're through a certain part of your therapy.
Dr. Lee, thank you so much for joining us. This has been great. I hope this has been helpful. Thank you for joining us.